Introduction to CT. This video does not show patients and staff wearing masks to prevent the spread of COVID-19. You might still need to wear a mask to your appointment. Before you can schedule a radiology exam, your doctor must place an order for it. If you have not yet scheduled your appointment, please make sure you contact the imaging department promptly. When you call to schedule, they will ask you a few questions about your health, explain the exam, and tell you how to prepare. They can also answer any questions or concerns you may have. A computed tomography scan, most often is called a CT or CAT scan, allows doctors to get a better picture of what's going on inside your body. It is one of the fastest and most accurate tools your doctor can use to come up with the right diagnosis and the best treatment plan. Using a combination of X-rays and software, the CT scanner provides detailed images of the body. Since the machine uses X-rays, there is a small amount of radiation. The machine uses as little radiation as possible to create images that are very clear so that your doctor can make an accurate diagnosis. The CT is a donut-shaped machine that is open at both ends. The bed you lie on moves in and out of the machine while it takes images. It is normal for the machine to make sounds while it is working. Here is an example of what you might hear. The CT scan is very fast and is over in minutes. If you have any questions about your scan, please call the imaging department. Preparing for your CT scan. When you first arrive at the imaging department, please check in at the front desk. You may have to fill out a few forms and answer some questions, such as if you have allergies or if you're pregnant or breastfeeding. If you've been scanned before, you might be asked to provide details and images from those previous exams. After you finish the forms, you may have to wait a few more minutes. When they are ready for you, a technologist will bring you back to do any final preparation before the scan. They may ask you for more details about your medical history, and they might need to collect a blood sample. You may also have to change into a gown, depending on what area of the body is being scanned. CT scanners use a very small amount of radiation in order to create images. You may be getting a CT with contrast. Contrast is used to highlight different structures and tissues inside your body. You may get contrast as an injection or as a smoothie drink, depending on the exam. Once you are in the CT room, the technologist will help you onto the bed. If you are getting an IV contrast, you may feel a warm sensation or get a metallic taste in your mouth. That is normal, and it passes quickly. When the scan starts, the technologist will go to their station. They will be able to see and hear you the whole time. During the scan, you may be asked to hold your breath for a short time. The bed will move in and out of the machine a few times. Try to stay still during the scan. Movements can make the images blurry, and they may have to be taken again. The scan will be very quick, lasting about 10 minutes. After your exam is finished, the technologist will come back and help you out of the room. They won't be able to tell you the results. You will get them from your doctor. After the scan, a radiologist will read the images and create a report of what they see. They will send the report over to your doctor who ordered the scan. After reviewing the report, your doctor will talk to you about the next steps, depending on the results. If your doctor recommends you come back for another scan, please call the imaging department as soon as you can, since it can take time to get an appointment on the calendar. Please remember that you can always discuss any questions about this scan with your doctor or another healthcare professional.